Health Beat, brought to you by Shannon Medical Center and Shannon Clinic.
If you have diabetes, you are at a higher risk of developing diabetic retinopathy. This common condition causes the blood vessels in the eyes to break down, causing the blood flow in the retina to decrease over time.
When this happens, several things can happen in the patient's retina. Sometimes abnormal blood vessels can form inside the eye. These abnormal blood vessels, they actually tend to bleed. So a patient could actually be walking around the community with diabetic retinopathy, not even realizing that they have an issue until these blood vessels actually start to bleed, and they all of a sudden they just cannot see anything out of their eyes.
The degree in which retinopathy may take place correlates with how well a patient's diabetes is controlled.
Once the diabetes starts affecting vision, the treatment actually is very varied and depends on what the problem is. If the patient has abnormal blood vessels inside the eye, which are bleeding and obscuring the vision, these patients usually either need surgery to remove this blood or laser if the blood that they have inside the eye is not too dense. Sometimes actually can resolve on its own. But to prevent additional bleeding, we can actually do a special laser in the office. So it's actually an outpatient procedure that can be easily done.
Preventative screenings and annual eye evaluations are recommended for patients with diabetes. For more information on diabetic retinopathy, call Shannon Ophthalmology at 481-2286.